Hi everyone. So today we're just going to go through a webinar. We're going to discuss violence in the workplace for health and care workers and how technology can be used in innovative ways to help solve the problems of those workers. Before we get going, I just want to confirm that everyone can hear us. And yeah, once we maybe if there's somebody in the chat who could just confirm that our audio is working, and we'll get going in about a minute. There's a chat box within the GoToWebinar menu. If you have any questions throughout this, feel free to questions or comments, feel free to add them in the chat, and hopefully if we have time, we'll get to as many as possible at the end. We're going to have also some polls throughout the presentation, so hopefully you'd like to share your experience along with us, and we'll maybe learn from that. So we're going to get started. Today, I'd like to introduce you to the concept of workplace violence for remote workers, and specifically in the health and cares field. And a little bit about myself. My name is Kyle Toohey. I'm the president of a software and services company called Scatterling. We do workforce safety monitoring and management. Personally, I have an experience. I have a formal training in technology and software sciences, and I have a lot of experience as a product manager, kind of going out there and seeing what people need in the field. Specific to this, we as an organization and myself have a background providing remote worker safety monitoring solutions and specific to health and care companies and organizations as well as others. So I'd like to talk about the current state of healthcare and how it's changing. So there is a trend towards providing care in people's homes and out in the community. And it's a shift in how healthcare has typically been provided. A lot of you probably know this intimately. So it's not, it's not just in facilities anymore, but it's also a growing field with an aging population. Health and care is certainly one of the largest growing fields and one of the largest growing need cases for workers and for worker safety. And with this changing delivery model, it adds some new challenges. So we see the job growth projected in health and care specifically at 18%. However, with this new changing model, we're seeing a demand for home health care specifically to outpace that at a 41% growth. And so that means more than 4 million jobs by 2026 as projected. But there's a bit of a catch. Not everyone's happy. All of these workers are in different job roles, but as a whole, they have a very high turnover rate. In fact, the average is as much as 25%, which is fairly significant, especially compared to other industries. That number goes up as high as 75% turnover rate in high crime areas. Another issue is that there's extremely high injury rates in health and care. What this all means, in fact, saying 4.3 per 1,000 full-time workers, that's an extremely high injury rate. And what this results in is a high cost of incidents, high cost of operation, lots of inefficiencies. It's very difficult to maintain and organize your staff, and it leads to a lower morale amongst all the caregivers, and of course that results in an affected quality of care is reduced, and for the organizations, the profit margins are reduced as a result. Now, all healthcare workers are at certain risks, but for the workers providing work out in homes, patients' homes, clients' homes, in the community, those risks change, and they actually increase as well when you're away from those facilities. So who we're talking about here is typically people like social workers, physiotherapists, occupational therapists, case managers, basically anyone out in the community providing health and care services for community members or individual people or patients or clients. Typically, we're seeing that this is yielding up to 89% female workforce. So we're going to talk about kind of the issues at hand, but you know, the topic of violence. I just want to do a quick poll, jump to a poll here, and we'll talk about, you know, violence. I was hoping you could tell us from your own experiences, could violence be an issue for your organization? We'll just give a moment here for each of you to click on an option. It's fine if you don't know. So we're seeing 75% of you are saying yes, and that's a pretty significant result here. So let's talk about kind of the risk factors for all of these workers out remote. And I don't really want to go into each of these right now. We don't have the time, but I guess they're mostly grouped into sort of 5 categories of risk factor. The top being, or at the top of the list being motor vehicle, driving, commuting, bus. Basically, anytime you're on the road, there's risks of overheating in cars, there's risks of driving on ice, there's risks of accidents and all those situations that any traveling worker would have. Next, we talk about environmental risks. And these are things like potential unhygienic conditions, maybe a fire hazard, an unsafe building, something like that. Next is physical injury. This is where we talk about common situations like slip and fall, or fall downstairs, or even repetitive stress injuries, or even underlying medical issues. For example, a heart disease or a stroke or something like that that could result in an injury on the job. And another is infectious diseases. This is obviously specific to health and care, or most commonly so. You know, diseases can be passed by touch, airborne, fluid contact, or even needle stick. And so we recommend that you have, for each of these first four, you do your best to control the environment and have policies for those. And we'll have more information in later documents and webinars on those. But today we're mostly going to talk about I guess the most common one for our health and care, or most pertinent, is violence in the workplace. So here's a little bit of data from an OSHA report and kind of comparing healthcare, and this is why we want to focus on this. Basically violence in the health and care and social assistance kind of worker industries is significantly higher than any other industry. It's certainly notable. So this is some data showing a comparison of violent injuries resulting in days away from work. The green line being healthcare. So you can see it's quite a jump. And within that, not only just, you know, are there violence injuries, but the majority of those are actually caused from the, or instigated from the patient themselves. Again, this is data from 2013. It's from an OSHA report. And again, we're seeing the cause of those violent injuries is the most common and prevalent is hitting, kicking, beating, and shoving. And so effectively that means it's a violent act by the patient is a fairly common issue and as a result, we need to deal with it. So violence is a common cause, we know that, so now we need to look into solutions. And realistically, there is no one quick fix solution. What it needs is kind of a comprehensive violence prevention program, a holistic approach for your entire organization. It'll take some time and some effort, but hopefully with some of the topics we discuss in today's presentation, we'll give you some tools. So at a minimum, you want to create this policy. You want to create a zero tolerance policy for violence. You want to have a no weapons policy. And then you want to have a bunch of other steps and procedures and processes in place to help each of your workers either prevent those situations or deal with them once they do occur. And a lot of that can be done through procedures, through education and training, and a little bit through, I guess, reviewing how things have happened in the past. So you need to have that reporting procedure. You need to have a culture where if an incident does happen, and a process and a procedure where each of those is logged and that data is audited and it can be looked at and analyzed. You need to educate your staff about what common risks are and kind of how to find them, and then train them on how to deal with them. We can provide tools for monitoring that as well. And you need to create that culture. So I just want to go through and discuss this concept of risk. And risk, you could sort of say, is you could almost quantify it in the sense that if you were to say there's a certain likelihood of an incident happening, and there's the common or average, or in this case severity, or of one incident or many incidents, you could say that risk is really a function of the likelihood of an incident and the likely severity of an incident. So basically, the higher those numbers, the higher the numbers of likelihood or severity, the higher your risk exposure. So we're going to jump to another poll here very quickly. And you know, I just want to ask you guys, how do you currently manage your team and your employees' risk exposure? I'll just give you a couple minutes to answer here. Okay, so we're seeing a lot of results at basic protocols. And this is great. I mean, you absolutely need certain basic protocols. We're seeing a couple with not even having any sort of management of that risk exposure, and so that's something you definitely want to consider addressing. We're going to provide you some tools to do that. So here's some suggestions as part of your plan. So the first thing you would want in a case, here's an example where you might have a person, a caregiver, let's say in this case, a nurse practitioner is visiting a client's home. They would want to have a lot of information about that and have an intake assessment about that patient, about that client's location, about what risk factors might be there. And that information could be gathered from a bunch of different places. But certainly having that documented ahead of time is very valuable, and then actually educating that caregiver and providing them that information prior to visit will prepare them for that. And that's a very, very important step in a process. And that's what that's going to do in our kind of risk formula, is to reduce the likelihood of an incident because you can prepare and you can take precautions ahead of time. Another ability is, you know, once you do enter a situation, each of the individual workers needs to be provided with the education and the capabilities to be able to spot those risks themselves. They need to be able to see red flags. They need to be able to identify hazards. They need to be able to identify if a situation has the potential to escalate or is on a positive trend, and they need to be able to be provided with these, some education on how this is done and training, because this isn't as simple as just using your gut sense. Everyone has a different way of assessing that. And there's also some best practices that can be available through some of our future documentation as well for this, but also sharing information and sharing the knowledge of how to identify these hazards. And so that can be actually done as a kind of an organization-wide education initiative. And again, this is to really reduce the likelihood of an incident occurring. Now, as part of that, to enable to be able to inform all of those previous steps of the intake assessment and the risk education, awareness, and red flag spotting, is there needs to be a comprehensive reporting procedure. So there needs to be a policy and a practice and a procedure within your organization where anytime there is a client or patient visit or site visit or facility visit, that the information that is in the heads of the caregivers who actually go out there in the field needs to be brought back and assimilated and shared. And so this doesn't necessarily mean just in case of an incident. However, it is very important if there is an accident or an incident that information is fully reported, and you need to have a policy and a common practice, and doing things in a consistent way is very important. But you also need to debrief when things go well as well, so that you can compare and contrast and identify the commonalities between the times where things go well and things go poorly. Now, for the caregivers out in the field, violence is an issue, and so that means that effectively that one or multiple persons is creating an environment where things are becoming more and more hostile. And that is often done on their own accord. And there can be many, many causes for this. Many common ones are drug abuse or untreated mental illness or alcohol abuse, or it could just be situational, things that might be happening at the time for that person. But if those situations do occur, there are some things that the caregiver can do to attempt to de-escalate those. And we're also going to be providing more documentation on this in the future as well. So if you stay on our list, you'll get a really great handy guidebook, but there's a bunch of steps you can do to train your people ahead of time on these skills to be able to de-escalate a situation. And this will reduce the likelihood of a heated situation turning into a violent encounter. Now, I also just want to take a second too and say that, de-escalating is important, but it's also important not to escalate a situation. So we're going to talk in a little bit about some technology solutions, and a common one that everyone jumps to mind is a panic button type solution. Now, you can imagine a situation where a caregiver feels a little bit nervous in a situation with an escalating client, patient, person who's in the environment, and by pulling out that panic button to prepare themselves, that in itself could actually escalate the situation. So we have some kind of practical and procedural processes of being able to compromise between having the benefits of that technology, that kind of technology, but also giving the ability for the caregiver to remain in that sort of neutral state as much as possible and not escalate, as well as learn to de-escalate. Now, of course, if something does happen, you need a very, very comprehensive protocol for response. And this includes who is going to find out about it, who is going to be notified and when, what actions they're going to take to resolve the situation. So this is very, very important. In fact, this is kind of, when an incident does happen, our goal is to reduce the severity of it from causing an incident or preventing an incident from becoming an accident, or preventing a small incident from becoming a major accident. And you can see lots of situations where maybe a provider is attacked, and by having help come in a relatively quick time or come at all, that prevents that from becoming a minor injury potentially, or it could be the difference between that and perhaps even as far as a death. And so it's really important to have that process in place, and it's going to be different for each organization and potentially each worker or each department or division. And so you need to be able to plan for that ahead of time, as opposed to waiting for those situations to come up and then hoping that the responders will know the right thing to do. So as part of that response process, one of the most important things to do is actually be aware. So those responders need to be able to be notified if something bad is happening, so that help can be sent. These care workers are often in groups of 1, 2, or 3 out in the homes and in the community. And so if something does happen to one or all of them, it's really important to get that distress signal out. And we're going to talk here. This concept is called lone worker monitoring and notification. Lone workers is just somebody who is away from help. So that can be one person who is a caregiver in the field. It can be a couple caregivers. The idea basically being that if something happens, they need a way to call for help or have help sent on their behalf if they can't call for help. And again, in our risk formula, this will significantly help reduce the severity of an incident. And so how do you do that? Well, there's lots of ways to do that. And first, that comes to everyone's mind is a way to call for help and basically a panic button. So that's great. You should absolutely, if possible, provide some sort of communication tool to be able to declare a panic situation. And that could be a technology device. We'll talk about that in a moment, where you can press a button and call for help. It could even just be a phone where you could call the appropriate people. But it's also not always a perfect solution. It's not a complete solution to just provide a panic button for their lone worker component. Those devices, sometimes you need, first of all, you may need a cell phone signal, and you could be in a rural environment without that. Those devices could become cumbersome. And as we talked about previously, pulling out one of those panic devices could escalate a situation and actually be the cause of the incident. But there's certainly something that is a great idea to provide so that the caregiver who might be in that distress situation, the violent situation, has the option of using it, and you can use their training and their judgment to use it appropriately. With our modern technology, some of those panic button devices actually have some motion feature capabilities. So you can do things like have an impact detection and simply just throw the device if you are in distress. And by impacting something, it'll be able to declare a panic, or even have a no motion alert. So if a caregiver is knocked unconscious, for example, the simple act of not moving could declare a panic, or even a shake for panic type thing. So that's not something that will intuitively escalate as much because there's not the obvious panic button press, but all lots of options, and the more options you have, the better. Sort of the best solution to have in complement with a panic button is a proactive check-in system. And this could be as simple as calling into a manager every so often and saying, I'm visiting so-and-so client, I should be here for this amount of time, and this is the situation. And then if they don't respond, then they know the context and the location, and they know to check on that person. But doing that becomes quite cumbersome as a procedure and a practice. If you have many caregivers out in the field, managers have other tasks they need to do. They're also humans, and they could forget or have errors. So you can actually get an automated type solution to be able to check in, set a timer, and then the simple act of not doing anything will start a distress call. It will put a worker into a panic. So effectively, this is amazing because you're taking action when everything is great, as opposed to waiting for situations where it's escalated or things are going bad or the violence is already occurring in order to call for help. So the simple act of not doing anything can call for help by having a timer that expires. We'll talk more about that in a moment. It also doesn't rely on a panic button device to have a cell phone signal, to not be broken, to have batteries, or even be just taken out of their hands by an assailant. Another part of this monitoring process is important to know about location. So when we talk about technology, the most common thing that we think about is GPS information. So we can get that with a lot of different devices these days. And that is super helpful to be able to locate a person and have a history too, a GPS history of where they have been. But sometimes that's not enough. And so in complement to that check-in procedure, it's great to be able to, when they are checking into a person or to a system, to have the ability to leave a message with pertinent, like maybe a voice or a text message with context information about a location. You can say what the hazards are. You can say what you're feeling about the situation. And that will help in response. It'll give a much better context. The location information will give a quicker response to the right location and a more efficient that context will be able to have the responders send the right help, whether it's fire, EMS, police, whatever it might be. And in a violent situation, it would be about typically sending police and maybe the right police, or when or where. And having that context allows them to do that with haste. Now, again, talking about this concept of escalation, whatever technology you use for this lone worker monitoring, it needs to be discrete. And so that's for this reason, devices themselves and purchasing a device to do this can be a great option, but it also needs to be complemented with something that functions like a check-in service, where the act of doing nothing is what actually can cause the alarm to be sounded. And this needs to be, this whole solution needs to be flexible. It's nice to plan a schedule at the start of each day and assume that it will be stuck to, but we all know that out in the field, things change, risk factors change, travel times change, patient visits are on a set schedule, but they often change from that. They take longer or less time. There could be new factors that come in on the road, so that a system needs to be flexible to be able to handle that kind of thing and provide the flexibility to the caregiver to make their own judgment calls. It kind of brings in the idea of, when you're doing your check-in process, you need to have the flexibility to check in, not just, for example, at the start and end of a visit. A common situation is you need to be able to adjust your check-in time based on a risk level, either through a risk assessment or through a judgment call of the actual person in the field. So an example might be an entry assessment. If you're visiting a new location, you have limited information in your intake form because it's a first-time visit. You could do an entry assessment where you set a check-in timer for a very short period, maybe 10 minutes, let's say, and you then enter. And if you do feel calm about the situation, you can then check in again at a longer time. Or if you're still feeling at risk or unsure, you can check in again for a short period and continue this process. And so what you're doing is you're actually checking in when things haven't escalated. You're not escalating the process by doing so, because you're not pulling out a panic button device. But if you are attacked, it's a very short time interval in order for that panic to be declared. And so this kind of flexibility is absolutely critical in providing the best sort of monitoring solution and best responses. And how do you actually do this? This is what we're talking about here, is technology out in the field. These days, the most common thing that everyone has in their pocket is a smartphone. So why not use it? It can be either a personal phone or a organization or company provided phone, but you can get apps and technology to be able to declare a panic. There's many panic apps, but as we talked about, the panic app itself isn't a complete solution. We here at Scatterling offer what we consider a complete solution, and you can use that mobile app to check in and get that GPS location data, the voice messages, and be flexible on the go. And it doesn't rely on devices themselves to be functioning when you're in a panic state. You can just use the device when everything is calm. There's also lots of great options for outside of cell phone area coverage. There's satellite messenger type devices. There's a couple of them shown there from different manufacturers. And all of these are great options for providing a tool for workers in the field. And of course, there are of course lots of panic button options, which can be a really great complement to this kind of end-to-end comprehensive check-in service, and ideally you want to automate that as well. So that's one type of solution, is to basically put devices in people's hands. Another is to just kind of let them use the devices that they already have or have available, things like phones, landlines, cell phones, and even computers that might be available. And by doing so, it allows total flexibility in the use of the system. And so instead of one option is to provide a panic button device that the caregiver would have to carry at all times. There's some downsides of that in that it's a cost and it relies on battery, and it's kind of relies on that particular device being connected and functioning and not taken out of their hands at all point in time. Another is to kind of use modern technologies and use what we call cloud services. And so instead of checking into a device, you're now actually checking into a cloud service where you have an account. And this concept works in the same way that you might have your Facebook account, which you can access on your home computer, your work computer, your cell phone, or even borrow a phone from somebody else and use it. And so at Scatterling, we have a cloud service to provide a check-in service where you automatically check in, and everything is done in the back end. And so that means once the check-in happens, the device can be stolen or broken, and it doesn't matter because that check-in has already occurred, the timer has started. You can also start a panic, and once that panic signal's gone through, that device can be taken out of your hands, and it doesn't matter. The information is still sent, and it will notify in a persistent way the right people and provide them all the information they need to respond. So talking about kind of next steps, we mentioned some of the technology that's available. We here at Scatterling can provide some of that, but it's just part of the process. What I would suggest, and these are kind of our recommendations for next steps for each of you who are attending this webinar, is to start with a holistic approach. And so you're going to start within your organization. You're going to establish a violence prevention work group and start the process and take it on as an initiative. So you're going to have to enlist support from your whoever would need support for things like budget or time or staffing, and just kind of a motivation. This needs to be an initiative for your organization. There's a bunch of huge benefits to it, but it needs to be taken on as a project of a whole. And your first step in doing that, once you've established your work group, is to actually conduct a risk assessment. And you can go to quite a detail of resolution on this. The obvious first step is to do a risk assessment base for your whole organization. But then you can break it down into specific job roles or specific geographies or whatever makes sense for the type of care that you provide and the type of communities that you visit. And create as much detail as you can so that you can have that risk assessment, and in your education process and your training, you can provide as much pertinent information and specific information, and try and think of all of those obvious risks ahead of time. And then you want to try and develop and implement control measures. So you've got our 5 risk factors, of which violence is one of them, and you want to try and control those as much as possible. This is one of the challenges of community care and home care as opposed to care in a facility. Is we can't control, we cannot put railings in a client's home until after a certain point. So that risk exists. We cannot have necessarily security guards at all times to limit the violence risk. You cannot have all the different things you need. You are on the road more often, so you're more exposed, but you can take steps to control those measures. So you can implement these systems, you can provide this technology, tools to be able to mitigate these. And again, go back to that risk exposure calculation. Try to see where you can limit the likelihood of an incident and limit the severity, and do what you can ahead of time to provide those systems. And it could be as simple as changing your protocols. Then what you want to do is look within that process. You want to provide the technology tools that match those control measures. So provide those technology tools, configure them according to your organization, configure them according to what capabilities are out there, and consider also what capabilities might be available in the future, and try to plan for that in your technology purchasing process. So purchase that technology, evaluate it, purchase it, deploy it, and then what you want to do is provide the education and training. So obviously the education and training on that technology itself, but that's just a piece of the puzzle. You want to provide that education that we talked about earlier on how to identify those red flags, on how to not escalate a situation, and tips for how to de-escalate a situation. That's extremely important. And then basically you'll send your people out into the field, but this is not done. This is an ongoing process. So obviously you'll be trying to monitor them and protect them as they go, but it's important to actually do an annual or quarterly or whatever makes sense for you, a regular audit and review of how things are going. What incidents have you had? What incidents have you not had as a result of your violence prevention program that you implemented? So that's why it's important to have those debrief sessions as an incident report when things go poorly and there is an accident, but also debrief when things go well. And so you can compare and contrast and find those spots. But all of this yields around, sort of hinges around a very, very important thing, is that you want to create a culture in your organization where safety is important, safety is talked about, safety is something that you care for, and that something that each of your workers ask for, so that they can be more involved in that feedback process. They can ask more of you as an organization, and you want to encourage that, because then you can provide them a better safety environment. You're going to get some huge benefits from doing this. You're going to see an increase obviously in worker safety. You're going to see an increase in morale, and therefore quality of care, efficiency. And you're also going to help eliminate that issue of staffing and turnover rates. So you're going to see an increased ability to gain new staff, as well as to keep them with high morale. And you're going to see a decrease in absenteeism, in costs and long-term and short-term disability due to incidents. You're going to see costs for incidents, potentially for fines. You're going to see a decrease in all of this stuff, and all of just the costs of an incident. You're going to see a definite decrease in turnover and your staff leaving. And basically, going back to our risk formula, you're going to see a decrease in the number, or the likelihood of incidents that occur, and then you're going to see a decrease in the severity. So you're going to see a decrease of how many of those incidents become accidents, as opposed to a near miss type situation, which will, kind of going back to our risk formula, lower your risk exposure and provide just a much better working environment and a more efficient organization. So we're going to jump now to a poll. We've kind of completed our first stage of this. I just wanted to ask you if any of you are looking to implement a worker safety solution for your company or organization within the next 3 months. And what I mean by this is not necessarily the software part, but just assess the whole process, taking the whole steps, starting with your creating your work group for this. We'll just give you a moment to answer here. Yeah, so it looks like we've got quite a few people who are attending this, who actually do want to, and we can definitely follow up with you and help with this process, and we'll be providing more tools to help walk you through this. For example, we have a great hazard assessment guide available. Those of you who already have a process, it's really good to always, again, do that audit and reassess it and see if it does match kind of your end-to-end needs from there. And I just wanted to talk a moment here about who we are and why this is pertinent. So we're an organization called Scatterling. We actually have a sister product called Safety Line that you may have heard of. But effectively what we do is cloud-based software solution for lone worker safety monitoring. So we provide devices, we provide integration, and we provide kind of an end-to-end solution for the technology component of that whole process of providing a worker safety monitoring. And we do kind of specialize and have a lot of history with health and care. We do other industries as well, but we definitely have some expertise there. Beyond our software tool itself, we actually do, as part of deployment, we actually consult on best practices for responses and for configurations and practices and policies. So if you'd like more information, we'd be happy to hear from you. But I just want to say thank you, everyone, for your time today, and thanks for joining. And we're just going to go through and see if we had any questions. Okay, it looks like everything's great. So again, thank you for attending. We'll be following up kind of over time. If you join our mailing list, you'll get a lot of helpful information on how to actually go through this process, how to do your hazard assessments, your risk assessments, how to create these policies and programs. That's useful information beyond just the technology tool, and you might find useful even if you choose not to use us. But thank you, everyone, for your time. And if you do have more interest in our product, please follow up and take a look at scatterling.co. That's a .ca. That's not a typo. That is our website, scatterling.co, or info@scatterling.co. So thank you, everyone, and we're going to just put out a survey here at the end, and thank you, everyone, for attending. We'll move to that.